It's Pharma time.
Hello, Vet Buddies!
It's Group 3.
In this video, we are going to talk about the history of veterinary pharmacology.
And this topic will be discussed by Cindy Rosalama.
Pharmacology is defined as the study of drugs, including their origins, history, uses, and properties. It came from the Greek word pharmakos, meaning medicine or drugs, and logos, meaning study. Pharmacology mainly focuses on the actions of drugs on the body. In this presentation, we will be knowing some of the important historical developments and personalities who had made a contribution to pharmacology. First, in the ancient medicine is the RIGVEDA. It is the oldest record of civilization and describes the value of medicinal herbs. Next in line is the AYURVEDA. From 4000 to 600 BC, it is a native system of traditional medicine to the Indian continent. Today, it is considered to be a form of complementary and alternative medicine in the world where several of its methods, such as the use of herbs, massage, and yoga as exercise are applied in the prevention and treatment of diseases. Ayurveda is pioneered by Charaka, Sushruta, and Vagbata. KAHUN Papyrus in 1800 BC is the oldest record of Egyptian drug codification. It deals with veterinary medicine and uterine disease of women and contains a number of prescriptions. Next is the EBERS Papyrus in 1550 BC. It is the famous ancient Egyptian document written. It contains information about a number of diseases and some 700 formulas and remedies. Various prescriptions, including those of castor oil, opium, colchicum, and some other drugs, are still in use. The earliest written compilation of drug is the Chinese herbal formula or materia medica, Pen Chao, which was written by Emperor Shennong in 2700 BC. It recorded over 365 medicinal substances, including many vegetable and mineral preparations and an animal products as well, some of which are applicable even today. Next, we have Hippocrates from 460 to 375 BC. He is a Greek physician considered as father of medicine. He advocates little use of drugs, maintained very high ethical standard of practice, above all do no harm, and attempted to treat disease based on 4 elements of nature, which is the water, fire, air, and earth. We also have Aristotle from 384 to 322 BC. He gave scientific basis for medicine who recorded numerous observations on animals. Next, we have Theophrastus from 380 to 287 BC. He is a great Greek philosopher and natural scientist called father of pharmacognosy. He is a pupil of Aristotle who systematically classified medicinal plants on the basis of their medicinal characteristics rather than their recommended use in treatment. Pedanius Dioscorides in 30 to 90 AD is a surgeon who compiled the work of Theophrastus and wrote the first Materia Medica, which consisted of 6 volumes and described 600 plants. Drugs were discussed from the standpoint of name, source, identification, test for adulteration, preparation of dosage form, what it would do, and for what condition it would be used. Next in line is Galen from 131 to 200 AD. Claudius Galenus, better known as Galen, is a prominent Roman physician and philosopher of Greek origin. He earned a reputation as a practitioner and a public demonstrator of anatomy as he performed extensive dissection and vivisection on animals. Following the fall of Roman Empire, Europe entered the Dark Ages, during which time there was little advancement in intellectual development. Custodian of knowledge and medical thought during this period were found in Muslims. Geber ibn Hijar from 702 to 765 is an intellectual Persian writer. He classified drugs and poisons of his time and stated that the difference between a drug and a poison was just a matter of dosage. He has given the statement that any drug can be toxic if given in large enough amounts.
We'll just continue this topic in the next video. Thank you and bye.